Thank you. Thank you for the organizers for this invitation. Thank you, Tim, for building this symposium. I'm very, very proud and very glad to be here in this university, talking for you in this university. It was because of all the movements, political movements in the 60s in this university, that I choose to go to the psychology first. And maybe because of that, I am now what we call a community psychologist. And it's why I am working this housing first movement, as Tim said. Now we are changing the university perspective of social intervention. Homelessness during many decades was being supported in the best way they could from religious organizations. They did the best they could in the common sense and in their philosophical perspectives. The university didn't give an idea, a perspective, a solution. Finally, we are not only analyzing the problem, not only study the problem, but we are helping to end homelessness, because we are putting all the knowledge and the research methodologies not only as action research in terms of intervening, but also in a collaborative way to change the situation. And it's what I am doing in my university. It's to research the changing process of housing first. What housing first brings new in terms of conceptualization, in terms of theory, methodology, and intervention, and public policy. So to study change as a research methodology, and to study the social change of this example of housing first as an object of research. And housing first has bring so many changes, so important in terms of theory, in terms of intervention, and in terms of public policies. And that is what I'm going to demonstrate. I have a couple of students that they are doing their thesis on all this process, getting data, how people, the participants feel the process of change, the politicians and the professionals, how they feel all the change process. As my colleagues already said, these are the main changes of housing first brings in these three dimensions: theory, interventions, and public policy. During decades, homelessness and the policies, the political decision makers enjoy so many studies from psychology and psychiatry that put the problem of the homelessness in their individual process. It was very useful. And the politicians said, well, this is not our problem, this is a mental health problem. But Mary Beth Chin made a study in New York and asked them what they need, what are the main problems that you feel to the homelessness. And all the majority, 90%, said what we need is a house. Probably in the counselors, in many meetings with the psychologists, they said that. But the professionals didn't hear and didn't take seriously what they were saying. And now we are respecting that research, that results, and we change the methodology. We consider that homelessness is essentially a social, political problem and not an individual, a genetic, a psychiatric problem. So now it's why we separate housing from treatment. And we give the house first, and we take care of the problem of psychiatric or other problems that come after. And because also we do this because works well, people came out of the streets, and because the house plays a very important role in our lives and for them too in terms of recovery. Even coming to the house, they became better. The symptomatology reduces and they are more open to listen and to talk to other people. So the first change in theory and public policy, it was this separation between house and treatment. It was a revolution, epistemological revolution. Psychiatrists citing house, another thing that is bringing very new this movement of housing first. It's the scattering, distribute in the community, not concentrate like we did. What we are doing here in Housing First movement, ending homelessness, it's what you did here in France with the bidonville in the end of the 60s and 70s. It was over. You just finished the bidonvilles with housing, public housing. But now, this is a new idea. Instead of putting people, homelessness people, in public, in massive group homes, massive housing, we put them in the community. Scattering, distribute in the community, and individualized housing. This is very important, and I'm going to talk about that. And why we do this? Because I'm going to explain it's cheaper, that it's a great discovery that it's cheaper, and works better for community integration. It helps the community integration. The other idea that it's a very important change, it's the participant choice. Where do you want to live? In what part of the city? In what part of Paris do you want to live? Do you want to live where you used to stay on the streets, or you want to live in another part? That's very important. If they move to a house, if they don't like that geographic area, they can move to another house. They move because it's renting house, it's easy. We can move people. Renting houses helps us very much to do this. The recovery orientation, as my colleagues already talked, it's housing helps the recovery. I have a student that's researching how important it's the house, the meaning of the house for recovery, and to research with the participants what you feel being in a house, what is the problems, how to be identified with the house. There is so many interesting studies about the conceptualization and the meaning of the house. And the commitment, another thing that is changing a lot, it's in terms of intervention, means intervention, professionals intervention. This is a program that the professionals, they have to have a commitment to work with the participant as long as they need, and they work in a different perspective. I'm going to talk after. So, what are the changes that are bringing the housing first? First is the criticism of staircase model, like Tim already mentioned, not effective in terms of facilitating the access to housing. The staircasing model, that is, first you have to go to a shelter, and after the shelter to a group home, and after the group home, if you behave very well, if you get better, you move to a house. That doesn't work. People doesn't move to a house, never gets enough better to move to a house, so they stay the most in group homes. So instead of the staircase, they move directly to a house. Housing first reduces homelessness in all the studies that have been done in the United States, Canada, and in Europe. 80% to 90% housing retention rates. It's amazing. People stay in the houses in many studies to 90%. Housing first reduce the use of emergency service, hospitalization and jailing, and improve health and mental health, as the Canadian group already said. In our program in Portugal, we move already 50 people from the streets to the house. The number of participants reporting having to use the emergency service decreased 87%. The number of admissions in psychiatric hospitals decreased by 90%. People, when they move to the house, they reduce the hospitalization 90%, and no one report having spent the night on a police station after moving into the housing. Can you see how much, in terms of public policy, how much cost reductions this means? Implications for practice. First, the immediate access to permanent housing. Second, the provision of service. We have to offer service 24 hours, 7 days a week. Not every time. The staff doesn't live in the houses, but they are available if they need to help participants keep housing, facilitate recovery and community integration. True, home visits, but participants don't live with the staff. Like in group homes, they live with the staff. Support services are provided in community contexts. This is one of the big changes for professionals. The people don't come to the office to talk to the professionals. The professionals have to move to the community. It's a very ecological methodology. So another big change in terms of theory and practice. No risk of losing the house in case of crisis or hospitalization. If they get in crisis or hospitalization, they don't lose the house. The house stays waiting for them. Separation between this situation, housing, maintenance, rent payment, contract renewal. Individualized housing is associated with more engagement in meaningful activities in the neighborhood and sense of community belonging. Some studies that are coming up, we are doing this study, how scattering housing, how housing dispersed in the community and individualized facilitates the community integration, because they need to talk to the neighbors, they need to use the service, so this facilitates. And people sometimes say, but they are individualized houses, they are feeling alone or loneliness. No, there is no, because in this program, they have their individual house, but they have also activities together. They get together once a week. They have mutual help groups. The staff help them to create the bonding and networking in the community. So to live individualized housing doesn't mean to be alone. Housing in integrated neighborhoods and with access to diverse community research such as commerce and transports was positively associated with levels of community integration. Better quality of housing environment, apartment neighborhoods, is positively associated with the increase of housing stability, as well as psychological well-being and with community participants. In Lisbon, we rent small apartments, studios, T0, what we call very small but nice, very integrated in the community and economically sustainable. Integrated housing facilitates the contact and relationship with people that could be natural support, like the neighbors. So this integrated housing creates these links and these bondings with the neighborhoods. So scattering housing, it's not public housing. These are two examples of the replacement of bidonvilles in Portugal, the left in Portugal and in Paris. So we don't move homelessness people to these concentrate situations because they already have enough problems, and we are creating a new strategy. This is something new. Instead of going to these concentrate places, public housing, we move to the community like this one. This is more beautiful, integrate. This is in Lisbon only. This is in Lisbon, downtown, Chiado, beautiful neighborhoods. So this is something that can be generalized to other groups, not only homelessness people, but immigrants and other groups. To integrate in the community facilitates the recovery. Implications for practice. Scattering housing allows more choice. I want to live in this place, and I don't want to, based on housing location preference. Wrapped placement. Renting house, it's wrapped. Public housing, sometimes you have to wait 1 month, 2 months. In renting house, it's immediately. We have already 2-3 houses empty immediately. We talk to people, do you want to move to a house? You can move immediately. And if it doesn't work, if there isn't a problem, we finish the contract. Rapid placement, live in the street, and easy relocation if necessary. It's why it's renting. It's because it's cheaper and works much efficacy. Contact with the neighbors and local communities are a normative contest for community participants, and landlords as partners. That is a good experience, so it was well mentioned, to work with landlords, because we are talking about social change. And if we go to public housing, we just talk always with the same professionals, with the same bureaucrats. With landlords, it is another group to make social change. They help us to make social change, and we are doing social change. That is very important for us. Most participants prefer, in many research process, an independent accommodation, their own apartment. To live with they might live with a friend or a partner, but not with other people with mental illness. They say, I want to live with a friend, with a partner, but not with other people with the same problem. Staff available, but they don't want to live with them. That is what they say. Participant choice and control over their house and the support they receive increase housing satisfaction, perceived quality of life, and community integration. More implications for practice. Participants choose where they want to live and with whom. Participants are, sometimes people, oh God, houses, and they do what they want. That it's not too much. No, that it's the best way. That it's the best way for recovery, for people getting better, for people getting integrated, to be citizens. That's a short way. Participants are encouraged and supported in selecting priorities and decision-making regarding their future and a new stage of life. Collaboration. We work with them. Participants' knowledge, experience, and interests are valued. Collaboration in drawing, implementing, and monitoring the intervention, and rebalance of power in their relationship with professionals. It's not to be only empathic. It's not to be only understanding, but it's to work collaboratively. In our project, we have some people with experience of homelessness working in the project, in this implementing, monitoring the intervention. The recovery orientation process, it's very important. What means recovery? Recovery in this community perspective, it's not interior. Now people are talking about recovery as within process. Recovery in this perspective is access to community resources, access to value social roles, social relationships, community participation, control and mastery in various spheres of life, and sense of community. And I took this from many people, but from the people who create the concept of recovery, Patricia Degan and Fisher. They said that, and now many people are saying other things, but this is what the recovery means. What the profession, a big change in terms of professions. I don't want to be too enthusiastic, but I think now Housing First is creating a new methodology of professionals as so different, so complex, and so theoretically so interesting, like many other discoveries in the last century. We are focused in concrete problem resolution. Professionals move to the community. It's ecological perspective. They move to the house, they move where the people are. Since the beginning, asking them to move to the house and keep it. And facilitate the access to the service and resources that are available to the general population. So we are not the facilitator between the person, the family, or between the person and their within problem, but the person with the community. We facilitate them. See, these are the things that we take care priority. Forced income and social benefits, documents and legal issues, house management, how to learn to manage the house, community research, contacts with health service, neighborhood and landlords, individual projects. We are specialized in bridging and bonding with the community, how to create bondings, how to create links with the community. Collaboration with other community stakeholders, partners in the community. Some people take more time to get housing stability. Why? We have to work in a long run. It's not telling, politicians want to say sometimes, it's 1 year, 2 years. This has to be in the long run, because some people take more time to get housing stability, because recovery is not a linear process. The intensity of support depends on participants' needs over time. Support needs change over time. New challenges and options like education, employment, or contact with the families. So this has to be a long-run process. Implications for practice. Support is not limited in time. Support services are flexible, individualized, and tailored to participants' needs and objectives. Continuous support of participants, even when they are hospitalized, in crisis, in temporary absence from the problem, or when changing address. Addressing homelessness as a social problem, shifting. What are the implications for public policies? First, as I said in the beginning, addressing homelessness as a social problem, shifting from an individualistic perspective, focus on individual problems and treatment to an ecological one. Second, to avoid concentration in social neighborhoods by subsidizing renting on scattering site housing in regular neighborhoods. Third, promotion for a dynamic rental housing market. We are helping this renting housing market, social renting housing market has been very interesting. This is helping change all this renting system in different countries. Innovation is sustainable and economic efficient. This very interesting to finish my intervention. Social innovation can be cheaper, cost effective. These political decision makers, they are very excited about this too, and we can demonstrate. See in Portugal, you saw in Canada, see in Portugal. In our program, will cost 16 euros per client per day. In a shelter, to go in a shelter, it's 18 euros per client per day. If they sometimes some organization they pay a room in a pension or in a hotel's room costs 30 euros, the double. And to go to a psychiatric hospital, just entry in a psychiatric hospital costs 2,500 the entry. So it's not only better, it's human, it works, gives you recovery, and it's cheaper. Public policy should be based on scientific evidence. Finally, public policy should not follow what is the feeling and what is the sense commun, the good sense, but based on scientific evidence in order to address structurally social problems instead of maintaining assistancy practices like shelters and social canteens. Thank you.